That's kind of my ministry. It's the thing that I've been kind of writing and teaching and preaching about the last probably 7 or 8 years. Once I realized that I was a superwoman myself, but not necessarily in a good way. Who's familiar with the Superwoman syndrome, the Superwoman complex? Yeah. So we are familiar, particularly as women, the majority of us are women here, specifically as Black women, and even more specifically as type A Black women. Those of us who do it all, achieve it all, have all the businesses, right? Got all the degrees, joined all the organizations, doing these wonderful things for all these other people, and then ultimately leave ourselves last. We don't necessarily mean to. We feel probably, based on societal standards, ladies over here too, based on societal standards, the way we were raised, the go-getter, grind culture that we're living in, that we're just supposed to behave in these ways, but then you would end up in my office with the hypertension, with the insomnia, with the diabetes because you can't eat right because you're comfort eating, the addiction, all the things, all the bad things. So I've kind of made it my goal in life now to preach about this because there is a way that we can take better care of ourselves. We have to. If the pandemic hasn't taught us anything, it's taught us that life is short and it leaves quickly, and we have to take advantage of every moment, and hopefully the majority of those moments are those where you prioritize yourself, and it's okay to do that. It's okay to do that. So let's talk about self-care for a moment. Self-care is this buzzword. It's turned into now what's called the soft life. Have you seen this on social media, the soft life? Where everyone's on a beach with the sand, the wind blowing in their hair and everything's lovely, and you're like, how do they make money? Like, do they work? Like, how are they living this luxurious life, forever? And so that's probably not as realistic as our usual regular lives, right? But let's share how we, particularly, we'll start with us up here, how we find whatever balance is. What do we do for self-care? What do you do for self-care, Valen?
So my first big thing was exercise. I've been in CrossFit for like 10 years. And it doesn't have to be like what you see it on TV, but it's very therapeutic for me being around other people, and come to find out they're just as successful as you, if not, they will be your connections down the road, but we're all there for the same reason, to just relax, work on ourselves, cheer for one another, and not professor this or the deadline is coming up. And I make it a priority, even so that when I came to weight research, I made sure my job hours worked around CrossFit. Because how am I going to be everything that you're hiring me for if I'm stressed out and I don't have anywhere to throw all this at? Let me throw down at the gym, and then I'll be at work at 8:30.
Right. You'll like me more, right? You'll like my attitude better. What is released when we exercise? What are those good feeling things? Endorphins. We need that to live. We need that to balance out cortisol, which is the opposite of that, right? Cortisol, we need to live. It's our fight or flight. It's our adrenaline. You gotta get up and go and do your thing, or an emergency situation. But too much cortisol is damaging. We need those good things, those endorphins, the serotonins and the dopamines. We need that to balance out. So I like how you advocate for yourself at work and said, listen, this is my schedule. This is my priority. Exercise is very important to me, so you don't have to work around that. I like that. Ms. Kendra, what do you do for self-care?
Well, actually, like I stated, I recently became an empty nester, so I was in a panic mode because, when you're used to doing everything for your kids and everyone's gone, you have to find yourself.
Speaking to the mic.
I'm sorry. Okay, I'm sorry. So when you used to have your children and, everyone is gone, I'm an empty nester now, so I have to find me. So that was really, really hard to do. So I took time in reading. I took time to know myself as being a woman, not just the mother, the wife, the daughter, but just me. So that was really tough, but I'm loving the new me.
What do? Do you turn the phone off? Do you
turn the phone off?
Okay.
I get a good book. I read, I walk, binge on Netflix, anything, but it's definitely a change.
Yeah.
But I'm lucky.
It's worth it.
It's worth it. It's worth it.
Yeah. Putting those things on your schedule, just like you put everyone else's stuff on the schedule, makes a difference. Blocking out the time for yourself. So self-care needs to be scheduled, it needs to be prioritized, and the people around you need to know when your time is. I'm very clear about sleep. Very clear. My 9 and 11-year-old know that around 9:30, it's time to hush. Go find something for yourself to do. Mommy is starting to wind down. My friends know on my phone, if you text me or call me around 9:30, you will not get a response unless it's, life or death. It's downtime, it's sleep time. So I commit to 6 to 8 hours as much as I can, at least per night of sleep, because sleep can be restorative. We need it. Again, this grind culture that we are professing is the way of life is wrong. Yeah. Is wrong, right? Yeah. There was some study recently, and don't get me misquoting, but there was a study apparently that said that naps now are supposed to right. I'm a napper, right? Yeah, that's true. There was a study, the audacity of the study to say that naps were damaging. That they lead to stroke and heart attack. I said, well, guess I'll be having a stroke then. I need that nap. I need that nap. It refreshes you. It helps bring down that cortisol. It helps your cells to regenerate. You need it. So please get your sleep. Please don't let this, no sleep culture, take you to the grave, right? Because all that stuff is related to all the things that you end up in the doctor's office about. Okay. So my segue from the Superwoman complex, self-care, healthcare is that mental health is health. Self-care is health. Things clearly that we, as Black women in the Black and brown community, deal with are huge health disparities, right? How many times have you heard the stories about Black maternal morbidity and child mortality? How many times have you heard about us having higher levels of hypertension, stroke, diabetes, all the bad things, right? We seem to lead the pack, right? The 3 most common causes of death, this is actually in 2020, so I'm very excited, well not excited, but I'm looking forward to seeing what in the next couple of years those 3 causes of death will be in the Black and brown community. But number 1 is, guess, heart disease. Number 2 cause of death in Black and brown communities recently, cancer. Number 3, COVID. Heart disease, cancer, COVID. Almost all of these things preventable in one way or another, right? Cancer, questionable depending on what type of cancer it is. Is it genetic? Do you have a family history of it, etc.? But lung cancer clearly is linked to smoking, and we smoke the most, right? Liver cancer related to alcohol abuse, we drink the most, right? Why is it? Let's kind of sidebar for a second. What is it about smoking and drinking that you think we are prone to doing this? We, as in the Black and brown community, are concerned. Why do we do it the most?
Emotional and traumatic suppression.
Suppression, emotional, yes.
Avoidance of stressors,
yes.
and trying to suppress it and
yes.
push through and be the superwoman.
Yes.
Doesn't I'm fine,
yes.
all is well, but really it's not. And those thoughts get started at the cellular level.
You got it. Self-medicating. Socializing, right? You go to the party, you go to the barbecue, everybody's doing it. Well, okay, I'm here, so I may as well. Yes.
Not communicating needs lack of communication.
Yes. So you're holding those feelings deep within, and then you're numbing yourself. Yes.
As a recovering alcoholic, for me, it was escaping reality.
Yeah. Escapism, huge.
I think it's convenient. It's
Convenient. It's convenient, it's marketed to us specifically in different ways. So you have to be cognizant, you have to be aware, particularly when it comes to our children. Remember back in the day we had the candy cigarettes? Right? And the camel, the cartoon camel, he was cute, right? We were being drawn to those things. It was being made commonplace. It's not cute. It's very damaging. Good. So being aware of those things hopefully can prevent those detrimental effects that you end up in the hospital with hopefully can prolong your life, increase your quality and quantity of life. COVID clearly has been a huge problem in the past couple of years. We're still dealing with it, by the way. I like to see a lot of the masks in the building. My prayer is that many of you have gotten vaccinated and boosted, right? We're gonna talk a little bit about that. Wake Research had a lot to do with the Pfizer COVID vaccine studies that went on. And actually, I'll have you ladies, since you were potentially involved in those types of studies, how important is it for us, particularly in the Black and brown community, to remember that COVID is still an issue and to learn more about the vaccinations and the treatments that are available?
Oh, definitely. And to remember that just because you're fine, you could be a potential carrier to someone who's not fine. Our older community that we cherish so much that pass on our traditions. And one of the great things that Wake Research have done, and what's the issue in the Black community, is we have taken one of our communities and placed it in a place that's majority African American based. We have a clinic in Fayetteville that is in the midst of Black community, military, all of that is there. So we're taking research to them, to people that maybe can't catch a bus and make it to clinical appointments, or the health department is too crowded, the emergency room, nobody wants to go to the emergency room for anything, God forbid, I don't go there. My children know mom will do anything to not go to the ER. But it's very important for us to stay educated and healthy for one another, and to pass that on, show our children this is how we take care of ourselves.
Ms. Kendra, anything to note, particularly about COVID and the vaccination research that we've been helping with?
When I started with Wake Research, it was in the COVID just started. So I came right in first week. Moderna, Pfizer just started, and it was bananas. I mean, and there were numerous people calling in, but to be honest, I mean, people of brown and complexion were not contacting us, or they were not contacting us in regards compared to others. And it is just a stigma that, unfortunately, that we have. But I've seen pretty much a 360, and that's great. And I was actually unaware of a lot of things from, just starting as well. Yeah. So it really opened my eyes as well, as far as COVID and with research. Yeah. Because it's very important, because we're not being tested or doing anything. I mean, how do you know how that's going to affect your community or your race or minority?
Correct. Who in the room has been involved with a clinical trial of any sort? In the room, very little, okay. So let's talk a little bit about what we think prevents us in the Black and brown community from being involved and volunteering for clinical trials and research. And Ms. Kendra brought up a very, very good point. It's hard to determine how we will be affected by medications, by treatments, by cancer drugs, by vaccinations, if we don't have enough Black and brown folks signing up to volunteer for the study. It's a problem. Because then that means when we do get sick and we need those things, not only is there fear, right? So if I'm talking to a patient about a new treatment, a new drug, a new vaccination, they may want to see the, when you see the studies, especially if they're pretty skilled in science and want to read the statistics and all that, and they'll realize, oh wait, this study only had 3% Black people, so how do I know how that's going to affect me? So then, if we don't have enough people to be involved in the study, not only do we not know how it will affect our bodies, but then once the thing is available, less people are less likely to use it because we didn't have enough people in the study. So there's a discrepancy there. How do we fix it? How do we fix it? And particularly for Black women, in terms of things that I get asked about all the time, fibroids, chronic BV. I know that's been a huge social media discussion recently about bacterial vaginosis and the prevention of that. COVID, vaccine, you name it. When it comes to Black women, how do we help each other feel more comfortable? What could we do, now that I'm kind of involved in the research side, to make it more palatable for us to be involved in these studies? Ms. Fallon, do you have any?
Yeah, I would definitely say it's lack of trust. And a lot of us have still remembrance of the Tuskegee trials, Black males being injected with syphilis, and we had a cure for it, but we wanted to see the progression of the disease. Even currently for younger people, Henrietta Lacks, who died of cervical cancer, and they used her cells and didn't tell the family. Even now with the family knowing, they aren't being compensated for all their mom has contributed. I grew up with a mom that didn't trust because of Tuskegee, and to be honest with you, I didn't see a doctor until I was 18 years old. And if she made sure we got our vaccines so the school wouldn't ask questions, but everything was, she was mixing things and aloe vera and this does this and eat elderberry, steam it this way, and I still do these things,
Right,
but
those
my
things
things
work.
Correct, and they work, they really do. It takes longer than conventional medicine, but we have to work harder at fighting these things, and actually racism, institutional racism, is a health problem. We're so used to being on guard as Black people of anyone outside of us that should I trust this individual? Are they hearing me, or are they trying to argue a fact with me? Pediatricians do it all the time. They show empathy instead of pushing info down your throat. Parents will listen to you if they say, I understand you, this is what I do with my kid. Instead of saying, you missed this shot, why didn't you go here? Or now you're all off schedule, we have to start all over again. They have figured it out. So we need to figure it out with people of our age now, how to develop trust in our communities.
Yeah. Any comments or questions yourself about why you think it's been so hard for us to be involved in studies and what can help? Yell out.
Representation, right? I think y'all are doing a good job of being Black women coming out and educating the community. I think that's what's important.
Very good. So she says representation, and I think that is improving. That's getting better. Yes, ma'am, with that.
One thing that would help me personally with like trust our OBGYN
trust.
because I don't even know what providers are out there.
Okay. So if your trusted providers knew about the studies and then themselves, they can have the conversation with you about the study. That's good. Yes, there's been a lot more outreach now, and I'm going to actually start doing more of that, going into clinics, telling my colleagues about the studies, particularly for their population, and then I can be a point person to answer questions, or they will be educated enough to know to answer those questions as well. Actually, the young lady behind you. And then
being more visible.
more visible.
Being more visible so that there can be a trust building time frame.
Yes.
If we see more people that look like us, that understand the plight, and they're in a position that can help progress the trust and the reliability of any testing,
Yes.
then that would help more people be involved.
Good.
with it.
The more visibility, the less secrecy, right? Less mystery. Very good. Yes, sir.
I think, so I'm a doctor as well, and in medical school I remember distinctly being downgraded for spending more than 15 times with my patients. So I think if we work at a systemic level in the medical community, and like you said, get more people that look like our patient population, our patient demographics, and then also allow the physicians to spend more time with people. I left medicine myself as well. Yeah.
Quit your job.
Because I didn't have the ability or the opportunity to spend enough time
Right.
with patients to truly listen to them and understand
You don't get paid for
where
that.
they're coming from, exactly. So now I've taken a hit, but it's for a greater purpose and greater fulfillment to actually listen to people and get to the root cause of disease.
Yes. There are good doctors out there, people. Find you a good one. If you don't have a good one, find you a good one. One more comment, and then we're going to wrap up before they kick us out.
Just one more thing, I'm also a PA, a medical provider. I think it's most important, I always consider the patient an expert in themselves.
Yes.
I'm an expert in medicine, and you are an expert in yourself. So please advocate for yourself in these places, right? This is kind of a bridge. It's very important. Don't be afraid to ask. That's okay.
Yep.
All right?
Advocate for yourself. It doesn't have to be adversarial. You don't have to fight. Like, we're here for the same reason. We want to take care of you. Help me help you, right? So that's wonderful. I love it. I love it. Good. All right. Last comments. What to leave them with? What would you like to say about research?
More importantly, with what the PA mentioned about advocating for yourself, because if you don't do it, no one will. Teach your children to advocate as well. I'm surprised when I sit down at the dinner table and hear what my sons tell me is going on at school. So we never skip a dinner meal at the table. Advocate. You can fire someone. You can fire I'm a nurse by trade. You can fire your nurse. If you feel like you're not being heard, next, move on. Stand up for yourselves.
Excellent. Ms. Kendra?
And I'll just echo on to what Malcolm said, be an advocate for yourself. Please feel free to give us a call. Check our website. We pass out numerous flyers in rural communities just to get more people of color in. So please feel free to give us a call. We're more than welcome to answer any questions.
And this is paid participation, by the way. This research these studies will pay
will
you.
be compensated.
Yes.
It will be. And so just please ask as many questions as possible. We're more than glad to answer this.
Very good. All right. It was a blessing to be with you all today. Thank you so much for coming. Get your shots if you want some shots. And I'll actually be on stage with Tamala Man at 3:55, and we'll talk more about health stuff. So see you from the stage. Thank you.